Radium-223-based alpha particle-emitting radiopharmaceutical therapies, in short, radium-223-based alpha-RPT, is gaining increasing clinical significance. It is important to provide reliable absorbed dose quantification for this alpha-RPT. However, this is challenging due to the low number of detected counts, the complicated emission spectrum of radium, and the stray radiation-related noise. According to previous studies, even fine-tuned traditional image reconstruction-based methods yielded high bias in the estimated activity uptake. Our objective is to develop and evaluate a projection domain quantification method, in short, PDQ method, for low-count quantitative SPECT for alpha-RPTs. The proposed PDQ method quantifies the activity uptake of each volume of interest, in short, VOI, directly from SPECT projections. The method takes each VOI as a whole and estimates the regional mean uptake by maximizing the probability of the occurrence of the mirrored projection data using an iterative process. We advanced the method originally proposed by Carson to address challenges for alpha-RPTs and implemented the method in 3D. We generated the system metrics of each VOI fully by Monte Carlo simulations in SNMMI. Thus, it can model and compensate for all image degrading process. Also, we have estimated and compensated the stray radiation-related noise in the iterative process. The performance of the proposed method was firstly evaluated by realistic simulation studies, as shown in the evaluation framework. Realistic patient phantoms were generated using SCAD, and then the projections were generated using simulated SPECT systems. We compared the performance of the proposed method with traditional OSEM-based method, and the method that used OSEM-based image reconstruction with GTM-based partial volume effect compensation, which we denote as GTM-based method. We have conducted a virtual imaging trial. In this trial, we have generated 50 realistic patient phantoms. The anatomic features and the regional mean uptake of those patient phantoms were all derived from clinical statistic data. We observed that in the virtual imaging trial, the proposed method outperformed both OSEM and GTM-based methods, and was approximately unbiased. In another experiment, we compared the precision of the proposed method with the calculated theoretical bound, and we observed that the proposed method yielded the theoretically lowest variance of any unbiased estimator. Besides, we also observed that the proposed method consistently yielded almost unbiased estimate for patients with different lesion sizes and lesion to bone uptake ratios, and outperformed the other two methods. The key assumption of the proposed method is that the activity uptake in each volume of interest is homogeneous, which may not be realistic in clinical scenario. Thus, we also evaluated the effect of the spatial intralesion heterogeneity on the performance of the proposed method. We also observed that the proposed method was not significantly affected by this heterogeneity, and it consistently outperformed both OSEM and GTM-based methods. Next, we evaluated the performance of the proposed method using physical phantom studies. An NMMI phantom and a 3D printed vertebral phantom were filled with clinically relevant radium-223 concentrations and scanned on a SPECT system. All three methods were applied. We observed that the proposed method also yielded the lowest normalized error, which is consistent with the result from the simulation studies. To conclude, the proposed projection domain quantification method provided reliable absolute quantification of regional uptake in SPECT at ultra-low count levels, as validated using simulation and physical phantom studies. The method could thus provide a mechanism for dose quantification with alpha-RPTs. In the future, we will evaluate the performance of the proposed method in clinical data and for therapies with other alpha-emitting isotopes. For example, we will present our work on joint quantification of the thorium and radium uptake using a multiple engineering window PDQ method in July in the Foley 3D meeting.